We're in mid-June, and after a period of really warm weather over the Jubilee weekend, we're back to being overcast and showery. In recent weeks, we've had lots of diagnoses of tick-borne disease, both in cattle and sheep. So in cattle, we've seen an outbreak of babesiosis. This is a parasite that's carried by ticks and can cause anemia in cattle. So affected cattle often will pass red urine, or they might even just be found dead. In sheep, we've also had diagnoses of tick-borne disease with several cases of louping ill diagnosed recently. So louping ill is a virus that's transmitted by ticks, and it can cause nervous signs in sheep. So often sheep will be seen perhaps a bit wobbly, perhaps trembling, and perhaps they might even have seizures. Other tick-borne diseases include anaplasma, so that's also known as tick-borne fever, and this is a parasite that really suppresses the sheep's immune system and makes them much more prone to other infections such as pasteurellosis. Often we see tick-borne disease when we get cattle and sheep introduced to tick pasture that they've never been on before, so perhaps bought-in animals. However, that's not always the case, and this year we've seen lots of cases where there are homebred animals being affected as well, so don't rule it out just because the affected animals are homebred. There's a student at the University of Edinburgh who's carrying out a survey on tick-borne disease and is asking farmers to give their experiences of tick-borne disease in their cattle and sheep. So please do follow the link to carry out the survey to help her gather useful information. In addition to tick-borne disease, we've also been investigating cases of parasitic disease causing scour in lambs and calves. So at this time of year, we often get problems with coccidiosis, and this year is no exception. Do remember though that there are lots of different causes of scour in lambs and calves, so do make sure you speak to your vet to get samples to ensure we get the right diagnosis and get the right treatment. If you follow the SCOPS forecast, there's a Nematodirus forecast there, and it's really useful to check that out. In many parts of Scotland, the peak of the Nematodirus hatch will have passed, but at the moment, in the Highlands, there's a really high risk of Nematodirus. And so if that's coinciding with lambs taking in sufficient quantities of grass, lambs in the Highlands could well be at risk of Nematodirus in the coming weeks. In recent weeks, we've also been investigating cases of sudden death, particularly in cattle. Sometimes this can be just a one-off condition, such as a twisted gut, but it might be representative of a wider problem, and often one that is preventable. They might, however, represent a wider spread problem, so we've had diagnoses of both black leg and Black's disease in recent weeks. These are diseases caused by clostridial bacteria, and really by the toxins produced by these bacteria that can result in sudden death. Worryingly, we've also had a couple of cases of toxicities, and so we've had 2 cases of lead poisoning in cattle in recent weeks. Lead poisoning in cattle might present as sudden deaths, or often it will present with animals appearing blind, and so if you do see these signs, do speak to your vet. In order to diagnose lead poisoning, we would need to receive blood samples from affected cattle, or if any cattle die, then a sample of kidney tissue can be tested for lead levels. Lead poisoning obviously has an implication to the food chain, and so when we make this diagnosis, it's important that we notify Food Standards Scotland to ensure that there's no risk to the food chain. Well, I hope the sun makes another appearance soon, and we'll see you in a few weeks for another update in July.